Welcome to today's program, Necessity-Driven Innovation. I'm Sean Wilkerson, Innovation Specialist at the United States Patent and Trademark Office, and I'll be your MC for today's program. Before we begin, just a reminder, if for any reason you get disconnected during the program, you can log back in at any time using the link that brought you here today. If you miss a portion of the program, don't worry. We will be recording today's session and posting it online in just a few weeks. And now, to begin today's program, a few words from Coke Morgan Stewart, the Acting Undersecretary and Acting Director here at the U.S. Patent and Trademark.
Hi, Sean. Thanks so much for that warm introduction and for everything you and your staff have done to make this symposium possible again this year. Welcome and good afternoon, everyone. It's great to be here today with all of you and our amazing speakers to talk about innovation and the pathways that lead to success. In President Trump's proclamation recognizing March as Women's History Month, he called for all Americans to celebrate the exceptional women in their lives and around the country. He added that women, and I quote, have made an incredible mark on the soul and the heartbeat of our nation. At USPTO, we've known this for a long time. For the past 15 years, this annual Women's Entrepreneurship Symposium has highlighted some of the most successful people in our society. They are innovators who are solving everyday problems by leveraging their intellectual property to patent inventions and to trademark their unique brands. All of you here have the potential to follow in these footsteps to make a life better for yourself, your family, and potentially millions of people. Our speakers today have traveled that road. They have created innovations born out of necessity. They have persevered to the point where they have created an entirely new life for themselves. One, a public school teacher and mother of 3 boys, created a collapsible baby bottle. Another speaker today is an emergency physician. She developed a medical device that is able to stop nosebleeds. With us also is a U.S. Army veteran and founder of the first woman-owned, veteran-owned, and minority-owned sock manufacturing company. And finally, we have an inventor who, after enduring her own battle with breast cancer, created a water-resistant garment to protect chest surgery patients while they are showering. Each of these entrepreneurs used their experience and creativity to invent a product, develop a business plan, and leverage their intellectual property. To all of you in our audience today, the United States Patent and Trademark Office is here to assist and support you with valuable resources and services on your innovation journey. We will work with you to patent your inventions and strengthen your brands. Protecting your intellectual property is something we have been doing since 1790. We look forward to hearing the stories of our innovators here with us today, and we look forward to working with all of you in the future. Thank you so much.
Thank you, Coke, for those remarks and for being a part of today's program. At this time, we'd like to ask all of our speakers to turn on their cameras and microphones for our panel discussion, Necessity-Driven Innovation. Moderating today's panel is Nancy Kamei, Chief Public Engagement Officer here at the United States Patent and Trademark Office. Nancy, the program is yours.
Great. Thanks so much, Coke, and thanks so much, Sean. Let me start by saying that the Greek philosopher Plato once said that our need will be the creator, articulating that a need can drive innovation. On the flip side, a CB Insights study noted that the #1 reason startups fail is because they created a product or service that didn't meet a real market need. Today, I'm joined by 4 inventors who each experienced a particular need, and that need and their innovative solutions form the core of their entrepreneurial journey. So to start, could each of you start with the need or the problem that you experienced, and then introduce yourself, your company, and the solution that you invented? Let's start with Payton.
Me, I was in the military for over 11 years as an Army engineer. And with that being said, I was experiencing foot problems as I would complete a lot of the accolades to be worn on the uniform on the left chest. So it was a lot of the blisters, the bleeding, and the pain. So what I did is I engineered a sock that we are able to, now it's now in the market, and now we're expanding on that in 3 different products as well. So.
Great. Liz?
Well, as an emergency physician, I was really struck by the number of people who showed up to the ER for nosebleeds. Believe it or not, we see 500,000 ER visits a year for nosebleeds. And I just couldn't believe that people would show up for such a simple problem. But I learned that they often mismanage their nosebleeds by putting their head back instead of forward, pinching the wrong location of their nose, and not holding constant pressure. So they panic, they show up to the ER and think they're going to be seen immediately because they're bleeding. But for me as a busy ER doc, this is not a gunshot wound or a heart attack, so they would have to wait. And my frustration is I had no tools to give them while they waited. So I created NasaClip, which is a hands-free nasal compression device that is sized for both adults as well as kids and enables anyone anywhere to stop nosebleeds quickly.
Sana?
Hi, I'm Sana Joffrey with Baby Gummy. I went camping with my son when he was 3 months, and I went to REI looking for a collapsible baby bottle because that's where they have all the products, and I couldn't find it. And I went traveling with my son, my first son, quite a bit as well, and realized that babies just have a lot of stuff and they take up a lot of space. And I wanted to solve a problem, which was saving space. One of the main jobs of a parent is to nourish their child. So we created Baby Gummy, which is a collapsible baby bottle. And it also is a 3-in-1 baby bottle. It goes from baby bottle to sippy cup to snack cup. So it helps reduce plastic waste.
Great. Lisa?
My name is Lisa Kreitz, and I'm the founder and inventor of the shower shirt. Essentially, I was diagnosed with breast cancer, and I had a bilateral mastectomy. And soon after my surgery, my doctor said, well, you can't shower with post-surgical drains in place. I said, no problem. I thought I would go home and just do a quick Google search and find a product to protect me while showering, and nothing existed. So I reached out to several doctors, and they were like, nothing exists, start designing one. So since that time, again, we invented the product, the shower shirt, and it's not only used by breast cancer patients, but it's used by many patient populations who've had either chest surgery or hemodialysis catheters, just anything that basically punctures the skin to protect themselves from tap water.
Great. Well, now let's move into the thinking around your business model and your customers. What research did you do to determine whether there was a product market fit? And did you do that research before or after you came up with your solution? Liz?
Well, so for me, I was a resident at GW when I thought of the idea for NasaClip. And initially, what I wanted to do is make sure that nothing existed that I could find in the marketplace. So a lot of times what I'll tell people if they think they have a novel idea is first, like, check the market. So, Amazon, Google search, see if there's something similar to what you're thinking of. And then of course, you need to do a patent search as well. And so that's one of the first things I did. And my whole pathway was accelerated because I was recommended by one of my attendings to submit our idea to the GW business plan competition. But before we did that, we knew we were going to publicly kind of display and announce what the idea was. And so we wanted to make sure that, our intellectual property was protected. So I had a fast track to having to submit a provisional patent before I made any public displays about my idea. So it indeed would be protected. So I would say I did, yes, do some preliminary research to make sure it existed, but then I jumped right to getting that patent in because we were on a deadline to submitting it. And then a part of that experience doing the business plan competition, I was introduced to the NSF I-Corps, the National Science Foundation I-Corps, which is an organization that really encourages you to do customer discovery, where you're really doing interviews with people who might use your product. So for me, it might be a parent, a coach, a nurse, or a trainer to ask them what they currently do for nosebleeds and if they'd be interested in something like NasaClip. And what this helps you do is ensure that you do have good product market fit before you pour your blood, sweat, and tears into an idea that you think is great.
Great. How about you, Sana?
I didn't move on my idea right away. So I had the idea when my son was 3 months, and I sat on it for a year or two. I just kept thinking about it, and I wasn't sure if I'm an educator by training. I didn't plan to be an entrepreneur. It wasn't part of my life journey. But I just kept thinking about it. And then one day I would go to Target and all these places and Amazon looking for it, and I couldn't find the product. And then one day I remember very clearly, it was right after Thanksgiving, I Googled it and I saw someone creating it. And I was like, oh my God, they're creating the idea, but their design was different. So I was like, oh, okay, well, I still have a chance. And I didn't want to die not trying. So right after that next day, I started trying, and I started researching patents actually right away, because I knew from Sarah Blakely's story, shout out Sarah, if I ever get to meet you, I'd love to do that. I knew that was super important as part of the process. So like if this other company had a different design, maybe someone already had my design and it wouldn't be worth the time. And luckily my friend she's an IP attorney, so she helped me kind of with the search. And then then we started making prototypes and talking to customers, as Liz said, starting to talk about to others if they also had this pain point, and went down the customer discovery journey.
Nice. Lisa?
I jumped right in because I was showering in a plastic trash bag, and I was not happy about that. I kept thinking emotionally, I've had breast cancer, a bilateral mastectomy, and how insulting it was to shower in a plastic trash bag. So I was right in calling doctors. I called. My background was health and medical journalism, so I could get to a lot of doctors. I could get to a lot of former breast cancer patients. And I said, what did you shower in? Oh, a trash bag, and it never worked, clearly, or saran wrap, and that didn't work. And it was all these stories. It was clear time after time again with former breast cancer patients, time after time again with surgeons, this product was needed. And to this day, I still say, why didn't it exist long before me? And I have some answers to that later. But no, I jumped right in immediately with research and development because I was the perfect research and developer because I was going through it, because I went through 1.5 years of complications, which I'll go into in just a minute. In terms of the IP, I'm married to an attorney. So I was even fearful, even talking to some of the doctors to say, I'm thinking about doing this. Of course, a lot of them were like, oh, I'll throw money into it. So I knew it was a good idea. But yes, we quickly went down the rabbit hole of researching intellectual property for a garment such as the shower shirt.
Great. And Peyton, how about you, the business model and your customers?
Yeah, so similar to Lisa, we jumped right into the R&D process immediately. I was deployed at the time in Korea, and we were exploring a lot of the Asian peninsula in that area at the time. And I was very fortunate enough to be able to not only have a lot of test subjects, because a lot of our feet were already destroyed, but also be right there in the footwear capital of the world. So kind of now the way that we model our business and kind of how that it's shaped is we're able to work alongside healthcare providers and different podiatrists and, the ortho and chiropractors and add it to their treatment plans and really see the difference, especially in the diabetic space. I'll never forget one time a diabetic patient came to me one time. He said, Peyton, your socks changed my life. In the moment, I didn't really think anything about it. He said, for the first time in years, I can walk comfortably, and I didn't realize how much pain I accepted. And to be able to hear that, that was the moment for me to be able to be like, hey, like we need to put more R&D toward this and submit an SBIR proposal and figure out what we're really doing, because we're really making an impact. And, it's an often overlooked item that nobody thinks about, but it really is the foundation of your body. So that was the all dropping moment, and really like, hey, Peyton, let's put some R&D behind this.
Wow, that's very moving. Well, let's move into the intellectual property part of your journey. So where in your journey did you start to think about whether you needed to protect your intellectual property, and what were your first steps in getting help for obtaining a patent, trademark, or copyright? Sana, let's start with you.
So again, a little late to the game compared to these other ladies, but we didn't submit our patent until like 1 year ago, and I've been working on this project for 8 years. So we were, I guess, a little risky. We didn't have the funds, I think, to submit the patent. And then we won a pitch competition which helped with that. And then so we applied for both our design and utility patent, and we've received already our design patent, and we're waiting to hear about our utility patent. So yeah, it was a little later, but the USPTO was helpful. I actually went through an accelerator with REI, and they brought in a speaker with the USPTO to talk about what the process is like and how to submit and how to find a lawyer, what the best routes are, things like that. And yeah, I mean, and then I had to go back to all the research I did originally and then bring that to my lawyer. And he said, Connie, you did maybe too much research because you're apparently like, you have to cite all the things that you present as part of your research process. And he was like, we'll cite it, but, just FYI, in case you do create another product, just, don't do too much because so that was my journey to the USPTO, and we were pleasantly surprised that we received our design patent. And yeah, that's a little bit about Baby Gummy and me.
That's great. Lisa, you kind of already mentioned the IP part. Do you have anything else to add?
I do. As Liz said earlier, and I have to say, when I was going through the process, especially for the viewers, I reached out to so many people, research, and everybody helped me. So I love this forum in terms of communication. Like Liz said earlier, just because there's not something on the market doesn't mean there's not IP. That doesn't mean a patent doesn't exist just because it's not on the market. So I immediately started doing that research in terms of, okay, I know there's not a shower shirt on the market. If there was, or something like it, I wouldn't be showering in a plastic trash bag. And at least one of the 100 doctors I talked to would know something exists, and Google would have known. So I knew it didn't exist on the market. That didn't mean there wasn't IP behind it. So I went through that process. I did a lot of my own writing with that because I was funding it, and got to an attorney in Washington, D.C. And we were very, very lucky. We ended up with a design. Our patent is design and method of use, design for the shower shirt, and then the method of use for showering in it. But we were very, very lucky. But I did so much research and so much writing on my own to try to keep the costs down. And then, like she just said that, Sana just said that, then the attorney would come on and say, okay, we can use this, we can't use this, we can use this. So I think as much as anyone can do in this process by themselves, it helps keep some of the costs down, research.
Great. Peyton, how about you?
Yes, for the IP side of us, very early on, it was just, trademark the name. After that, trademark the logo. And then it wasn't until I met your team at a couple of events a couple of years ago where we created the first ever sock mural in the world. Literally a piece of art. It's a mural made out of socks. And someone from your team was like, Peyton, you need to copyright this. I was like, oh, I could do that? I didn't even know I could do that. So it was from there, just kind of figuring out what we could actually copyright, being able to use the resources through the USPTO and the website, and utilizing those. And then taking it one step further now is we have a lot of patents where we have a couple utility and a couple provisional, and just really getting smart on what we can do and use the systems and what all the USPTO really does. So just knowing all the players, to say the least, within the USPTO office and utilizing them.
That's wonderful. How about you, Liz?
Uh-oh.
Uh-oh. Did we lose Liz?
Oh, I apologize. As I mentioned, I did go after that patent really early, which I'm glad I did because, unlike Lisa, it took a few years to get our patent. So we are both utility and design patent issued. We have multiple patents. We also did as well trademark our name, our slogan, our logo. All of those things are important. These are things that you probably don't know if you're still just getting into the game. And then in so many ways, protecting my IP as we evolved as a company has been important. So this is what our device looks like. It has these intranasal sponges that you can put vasoconstrictor on, place them in the nostrils, and then slide it into place. And I'd made it so you could have hands-free compression, be able to go about your business, leave it in place 10 to 20 minutes, and then release and check for bleeding. And I wanted it to deploy medicine that was helpful in the setting of nosebleeds. But while I continued to work in the ER, I realized that this device is actually good at deploying any type of intranasal med. So we actually just went back and submitted another patent to expand on this new reusable design where you can actually take it apart, and remove the sponges, which can be discarded. You can buy sponge refills and reuse this device. And now we're looking at making this a intranasal drug delivery platform with an initial focus on Narcan or naloxone, which is usually delivered by nasal spray. But I know as an ER doc, oftentimes in drug overdoses, we have to redose them and that spray washes out. It doesn't get good absorption. And so my hypothesis is that this device with its sponges that maintain contact with the mucosa and then putting that system under pressure is a better way to deliver intranasal drugs. And this is opening up a $43 billion intranasal drug delivery market and has actually just really skyrocketed the value of NasoClip outside of just the nosebleed treatment device that it started as. So I have continued to evolve our IP portfolio, and it is one of the most important assets that I have in my room and has really led to a lot of the successful fundraising that I've done.
Wow, and that's our next topic. So besides the business model and intellectual property, another important topic for innovators is financing. So can you each talk about how you found financing to move your projects toward commercialization? And did you work through programs like Kickstarter or SBIR, or did you find investors some other way? Lisa?
Well, I was very lucky, again, as a past journalist, and then I was doing media strategy within a healthcare system at the time. So I had access to creators, to designers. And since Liz popped this up, I just wanted to pop this up. This is our trademarked logo. And a good friend of mine created it for me. So I was so lucky. That was an example. He did it. I reached out to so many people I knew, and in terms of the IP, the trademarking, everything, the prototyping, my brother was an engineer. He helped me do the schematics. My aunt and my cousin created the first prototype. I was just so darn lucky because I had so many friends and colleagues that were helping me. So I did not have to reach out for funding, even though I had several doctors who said, I would love to invest in this idea. And my husband just kept saying, Lisa, if we can keep it by ourselves, let's do so. So luckily I was able to fund everything by myself, including all of the legal costs for the patent.
Wow. Peyton?
Yes, for us, we were very successful early on in terms of pitch competitions. Those small amounts that we were first able to pitch at Mark Rockefeller's Foundation, and then Warrior Horizon, Impact Ventures, and then Lift Fund. And then after that, we were able to submit an SBIR proposal to NIH. And then now we're working on actually another SBIR proposal to NASA. And we're having early conversations with investors actually as we speak. So,
Wow. Okay. Liz?
So I've been really fortunate in that I've raised a total of $4 million for this company, but it was not easy. So, I'll give you the journey. And in the very beginning, it became clear whenever you have a physical product, you need some capital usually upfront, especially if it's a medical product and there's going to be some regulations. It is not like necessarily like a digital technology where you might be able to get away with having less ability to have access to early capital. So I knew right away I needed to do fundraising. And usually that first round, they'll call a friends and family round. And so I did do that. I did 2 different convertible notes with about $1 million. And I had a lot of my physician colleagues who really came in on that, in addition to a few angel groups. But prior to that, the very first accelerator program I did was with TEDCO, which is a Maryland kind of state-based venture fund that they gave both funding, but also the kind of support and management instructions that kind of told me what I needed to do to get my business plan together and meet milestones so that when I went back to raise a seed round, which I'm currently in, we would be at the point where we could talk to institutional investors. So since then, I'm currently in the middle of a $4 million seed raise that is equity based, and we've closed 75% of that, so $3 million. And this is not an easy road to hoe. So I heard a lot of no's on my journey to raising $4 million. But on the way, I think what happened is I had the best kind of investors come in. And so now I'm happy that I have a cap table that includes angel groups, individual investors, venture capital, and then we also have crowdfunding. So we did launch a WeFunder campaign, which was an important part of this round that I wanted to make it accessible to anybody. So even if you're not an accredited investor, which is usually what's required to invest as an angel investor, meaning that you make more than $200,000 as an individual or 300 as a couple, or have a net worth of more than $1 million, which excludes a lot of people. On WeFunder, which I know a lot of these ladies kind of have talked about engaging in, it means anyone can invest as little as $100. And so I wanted to be able to make sure people from my community could take this journey with me. And so we have that going on right now on wefunder.com/NasaClip. And I'm really excited to see all the people who are just really want to see me reach this $1 billion exit that I'm going for, be on the journey with me. So I know that was long-winded, but I feel really passionate not only about the equity that is, I think, allowing innovations to reach the market from all different backgrounds, but also equity in the sense of who's able to invest.
Just a quick follow-up for you, though. What % of your time are you spending on fundraising right now?
So I would say I spent probably 50% of my time fundraising. It is, for some, it is a full-time job. I mean, most CEO and founders will tell you that we just work multiple full-time jobs. I also still work clinically in the hospital, and I'm a single mom of 2 girls who are 4 and 6. But my story is not uncommon. I say oftentimes that it is the resilience that we're forced to kind of exhibit in order to be successful in this space that makes us more successful. So although we only give 2% of venture capital to women, I always thought that was ironic because statistically, female founded teams are faster to revenue, faster to profitability, and often can bring 6x greater returns. So on paper, we're actually a better investment. And I think a lot of my drive is to be that story and that example so that I can really inspire the next generation of female investors to pursue their entrepreneurial journey.
Nice. How about you, Sana?
Yeah, I knew I wanted to keep equity. So my co-founder and I really wanted to do that as much as possible. So we started with bootstrapping, so using our own savings to help with funding the prototypes. We got lucky. One of my first product developers was a grad student at Northwestern. We're located in Chicago, which has industrial design and prototype kind of group. So we bootstrapped first, and then we went paid into pitch competitions. So we started the pitch competition circuit, and we got into, luckily, an accelerator with REI. So for me, it was really full circle moment because that's where I went to go find the product, and then it didn't exist. And that's true for my experience going in the outdoors and traveling and things like that. So pitch competitions and bootstrapping were kind of the initial, and right now we're actually on Kickstarter too. So we're not to market yet, but we are in our pre-launch phase. I just dropped it in the chat in case anyone wants it. So you can follow our page and you can get access to the bottle at the best rate you'll probably get it. That's one of the benefits of Kickstarter and these different sites. And I think one of the unique things about Kickstarter is that a lot of men use it. And so I really want to encourage women to use it because it's a great place to find unique products at the most discounted rate you'll probably ever find it, because you're helping to not only fund the vision, but also the product and bringing it to market. So that's been our fundraising journey.
Oh, that's a great tip. Okay, what has been the biggest challenge you've faced on your entrepreneurial journey to date? And what did you do to overcome that challenge? Hayden?
So I don't tell this story often, but I'm going to tell it here. So for me, last year, I had lost both of my grandparents in a matter of 2 months. Shortly after that, our warehouse facility was burglarized 2 times in less than 72 hours. And then I ruptured my Achilles, all within a matter of a week. So at that point, you can imagine how I felt. It was a lot, but honestly, it was the most clarity I had gotten in the business as well. And when I say that, we had shifted our model and it became a lot more health and tech integrated and a lot more focused. And I was really able to nurture some relationships and partnerships and really scale the business. And, for me, it was, yes, we lose one thing, but it's how bad do you really want it? Keep going. And I say this all the time, be so obsessed and laser focused and be resilient, and there's nothing but success for you. So that would be my most resilient moment in the business.
Thank you for sharing. Liz?
So I usually tell the story of my experience in 2020 as one of the most challenging years I had to overcome. I think 2020 obviously was a challenging year for most people because it was the pandemic. But for me, I was a full-time emergency physician working in Prince George County, Maryland, and our hospital was the hardest hit hospital in the state. I was 6 months pregnant when the pandemic hit. So I was intubating people in the parking lot. I had a toddler at home, and it was just utter chaos. And then in addition to that, I was having a lot of problems at home and dealing with marriage issues. So it was truly one of the most stressful times in my life. And then I finally made it to May 30th, 2020, and I delivered my healthy baby girl, and I rolled right into doing my accelerator program, which was now all virtual, so I could do it. And I breastfed my newborn infant through this accelerator program, and that is how I got my first capital and how I was able to get lift for the company. And now when I look back on it, I don't really know how I survived, but I do know that that is like what allowed me to believe that I could do anything, that I could absolutely make this company work, make it successful, because I made it through that year. And so all the ups and downs that come with running a startup were going to be like child's play if I could, make it through kind of the trauma that 2020 was for me. It's so much of a lesson for me that I'm almost grateful for that experience because I was so much stronger because of it.
Wow. How about you, Sana? What was your biggest challenge?
Yeah, I mean, I'm deeply inspired by these women. So, I think time, has been one of my biggest challenges. I still work full time. So I have a day job similar to Liz, and I have been working on this project for a long time. I think, and then I'm a mom. I'm a mom of three. I also had my son March of 2020, my second son, and then my last son just a year and a half ago. And I'm also going through a divorce. So it's been a really rough year, I would say, in my life. But I'm still here. So
Showing a lot of courage. Thank you. How about you, Lisa?
When I think about that and listening to the stories, I think of two very difficult issues. One, I believe I overcame, and one I pivoted on. And the first one was when, as I just talked about the history, breast cancer, I had a lot of complications. I had 7 surgeries, 2 hospital-acquired infections, and 4 months of hyperbaric oxygen treatments when I was creating the prototype, when I was creating the shower shirt logo with my friend, when I was working on IP. I would get up in the morning, I would have breakfast, and I would work on my idea for a couple hours, and I would go back to bed. And then I would get up and work a couple hours. So I realized once I got through that, I was really in the middle of treatment from all those complications from breast cancer surgery. Once I got through that, and that was behind me, and I basically had, I'm just going to say, 2 breasts again after 7 surgeries because it was a mess. It was disastrous because of these infections. You would understand that, Liz. When I got past that, having 2 breasts and still having an idea that was moving forward, I was like, oh my gosh, I can handle anything. So that's number one. And number 2, a big part of this, and Liz, it's really so cool listening to her talk because she's in the middle of a medical animal, and the shower shirt is considered a class 1 medical device. We did a lot like what a lot of people do. We immediately tried to get Medicare coverage. If you get Medicare coverage, then all of the other commercial insurance will fall into place. So I even spoke on the Hill. I presented to the HCPC committee, saying, would you want your mother showering in a plastic trash bag after breast amputation? We got a long way. Let's just say that. And we ended up, our Congressman, Debbie Wasserman Schultz, and Congressman Bill Posey filed the Post-Mastectomy Infection Reduction Act. Because essentially, in working with the HCPC committee, they said, Lisa, there are shower coverings for end-stage renal disease patients, but based on Medicare law, there's nothing for breast cancer patients. You get out there and your congressional liaisons, get them to file legislation. We did. And that was a great win for us. However, it was very young. This was years ago, and we didn't have $10,000 a month to pay lobbyists to get it pushed through. Nancy's, yes, you understand the bureaucracy, the animal of government. However, finally, I decided I could spend every day and every night pushing for Medicare coverage, and it may not happen. So I'm going to go back and focus. And I think that's a lesson learned in pivoting. Yes, plan A was this. Yes, we got on the market. Plan B, get Medicare and insurance coverage. That didn't work out under different, under these circumstances at the time. And now it's been a self-pay product, which in the big picture has not been a huge problem because it doesn't cost that much in the big picture. We've only increased our rates once in 10 years. So again, those were 2 lessons learned personally and professionally.
Great. Okay, our last question today is, from all the experience you've had on your entrepreneurial journey, what wisdom would you like to share with those in the audience today? Liz?
So I think that I'd like to leave a message that it's just so important that you have belief in self and vision in self, and that you value yourself. A lot of times when you're going on this entrepreneurial journey, you're really asking people to come with you. And it's going to be hard for them to take the journey with you, whether it's investing money, time, working with you, giving you connections, if they can't energetically and emotionally feel your passion and believe in it the way that you do. And another reason that they will be able to do that is if you are kind of appearing as your best self. So the second part of that is taking care of yourself during the journey, because this is a marathon, not a sprint, right? I actually first came up with this idea in 2015, didn't really start raising until 2020. We just entered the market last year, and now we're about to launch on, Amazon, and I think we're going to the moon, but there's still a lot ahead of me. And so I know that I have to enjoy the struggles and the ups and downs and have some balance in my life, whether that's making sure I'm there as a mom, that I still have some time to do clinical work, that I'm enjoying my friends, that I'm dating now that I'm divorced. All those things are important in creating like the best, most fulfilling life, which then in turn makes me the best CEO, the best founder, the best physician, the best mother, and the best human being.
And so are you saying your belief in yourself has grown over time, or as you exist today, are there some ways you really believe in yourself and then other new hurdles that you're facing at the same time?
There's always new hurdles and unforeseen hurdles, right? Like they're like the things I'm dealing with today, I couldn't even imagine dealing with before because we're growing as a company. And so I think that I always had this innate belief in self, right? That's what I mean by like, you have to have that light, that candle light that's inside first, but then it starts to grow and it becomes more resilient. So no matter what blows at it, what new challenges arise, like there's not really much that could ever wipe that out. So you always kind of have to have that internal fire, which is like a belief in self. And then nurturing yourself is also what allows you to kind of continue to burn brightly so that others can see you.
That's great. How about you, Sana? Your wisdom to share.
I have more than one, if that's okay. I think similar to Liz, yeah, definitely believing in yourself and taking care of yourself, both your mental health and physical health is super important. I think an ingredient to that is thinking about who you surround yourself with. Like, what message are you saying to yourself? What are your limiting beliefs? How can you counter those limiting beliefs? And who are you surrounding yourself with on your team, your cheerleaders? Everyone should be a cheerleader. If not, they need to go. So we don't have time for that. And that's really important. I think also as women, I think it's sometimes we're tasked with taking on so many roles, mothers, daughters, sisters, etc. But asking for help, we've all asked for help in our journey. Whether that was asking, for me, it was asking a random guy to help with me with my product development. And it turned out to be a great fit. So asking for help and getting out there. And then lastly, I think with this conversation around IP, solve a real problem, right? Like we're all here solving a real problem. And if you're solving a real problem, your entrepreneurship journey will be fruitful.
One of the things you had mentioned was reframing the negative.
Yeah, I think that's a huge thing. I mean, I think that as an entrepreneur, there's a lot of, and just as a person, I even talked to my son about this, we're often, there's all these things happening in our minds, but that's not always the true story. It's just like a story that's telling. So how can you, in the REI program, they brought in an expert that showed talk to us about how to reframe our limiting beliefs. So it might be like, so for example, Liz, maybe it's like, I'm never fundraise. that might be true, but you can rephrase that limiting belief by saying, I've never fundraised yet, and I can still be successful. I can learn that, right? So it's just adding that, like, it's not diminishing, like changing the reality. It's just reframing the thought. And you, once you start doing that on a cellular level, your body will actually start believing it, and your mind will believe it, and then it will come true. And so it's really important for bringing your vision to life is making sure that your mental state and those limiting beliefs are ways that you can tackle them in a way that and there's actual techniques that you can do to implement that.
Thanks for that. How about you, Lisa?
I interviewed a doctor recently for an article, coincidentally, on biohacking from an MD's perspective. And she said, we are what we think, what we believe, what we do, what we eat, and what we drink. And that has stuck with me. And I quoted her directly on that to support what Sana just said. I had mentioned this previously. There's an acronym called FEAR, and I use that often, stating false emotions appearing real. And I also, even when I feel that, I have to step back and say, and I did it for years, specifically in bringing the shower shirt to market and keeping the shower shirt on the market. False emotions appearing real. That's all that is. There was a couple different times. I just told my husband, I said, I quit. I am not doing this anymore. And he stood there and he smiled. He said, you can't quit now, Lisa. And it was because we were already on the market and we were selling. And it was too much at the time. And then I stepped back, false emotions appearing real. But I want to say one other thing, and this has been so big for me. This book I read right around the time the shower shirt company went on the market, because I was diagnosed with breast cancer in April 2009. We went on the market in April 2011. It was about 18 months. I may have the dates a little wrong. But with that said, I'm sorry, yes, it was 18 months. But with that said, I'd read this book by Catherine Kiersey, and it's called The Unstoppable. And it was all the big guys, like your founder podcast, Liz, the big guys, the Walmarts, the Walt Disney Worlds, the Domino Pizzas. And something just stood out so big. It said it's harder to bring a product to market that's never existed versus a product that already exists. You go back and change it 5 to 6% and try to get a new patent on it. And that really helped me, because I kept thinking, I'm bringing a product to market that's never existed. There's never been a water resistant garment like this on the market or at all. And that helped me a lot. So not only were we bringing a product that had never existed, we had to teach everyone what this was for. In the first few conferences we went to, which I'm big on, the group purchasing organizations, find a GPO in the niche, and that can really get a lot of eyes on your product. So many people walked by and said, why is the girl in the shirt in the shower? They had no idea. Unless you've gone through breast cancer, unless you've had post-surgical drains, you have no idea that doctors want to try to decrease the chances of waterborne illnesses. So those are the big scenarios when I think of my big learning moments with those four.
That's great. And how about you, Peyton? What wisdom would you like to share?
Yeah, so I'm going to leave with 4 as well. And they say that if you've heard something twice, then you should probably take note of it. So I'm going to echo a couple of things here. So in my way, I'm going to do it the unconventional way here. But first is thank the naysayers. There's going to be a lot of people out there that say, you can't do this, or, how's your little side business going, or whatever it is. And the truth of the reality is that they keep us up at night. But really, they fuel us to be better and to take our product to the next level and continue to break down those barriers and be that pioneer in the industry. Next is going to be buy yourself the flowers and smell them. And what that really means is really, as you complete those milestones in your business, acknowledge it. Take a second, celebrate it with your team, because it's not easy. Raising that 1.5 million or that 4 million, that takes a lot. And we stay up all night for that. We literally have a full-time job dedicated to that fundraising. So really, when you complete that, I like shoes. I like to buy shoes, not flowers, but really just really celebrate that moment in your business. And then next is going to be ask for help. Sana, you said this, and it's, closed mouths don't get fed. And if you don't open your mouth and say what you need, then you're not going to get the support that you need. So, a great example that I always think about is we wanted to do business with the WNBA. And I asked, who has a connection to the WNBA? It was kind of crickets at first, but a couple of people had reached out to me on LinkedIn, and we were able to land that deal solely based off me putting that out there to the world. And then lastly, the one I'm going to leave is, this one's a little more personal to me. My father instilled this into me early. And he said, great men move slowly. And when I say men, I mean mankind, not just men. But what that means is really with patience, perseverance, persistence, and resilience, you can do anything in life, and it just stay the course. It's not a marathon. It's a marathon, not a race, kind of as you said, Liz. But really with those things all encompassed, you can do anything. And this is my very favorite one. It's just remember, your energy is expansive, expensive, and exclusive. So those are my tips. Keep going on the journey. I said it already, stay focused, stay motivated, and you got this.
So please join me in thanking our wonderful panelists from today for being so open and also so inspiring. And now I'd like to turn the stage back to Sean to tell you where you can find resources to help you on your journey and wrap up the program. Sean?
Thank you, Nancy, and thank you, panelists. Before I begin, I'd like to ask for the survey slide to be put up. What you're about to see on your screen is our survey slide, and we value the information you provide in these surveys. It helps us to provide more content like this, or content that you may want to know about. So if you can put up the slide deck, Jay, and if you can use your phone and take a moment to fill out the survey. It is a brief survey, should take no more than 1 minute, but we'd like to get your feedback for future programming. And we're just going to leave that up for just a second. At this time, I'll invite our panelists to go ahead and turn off their cameras and microphones while I finish out the program. Thank you. And to start with some of our resources available, we'd like to talk about the opportunity to identify your IP. We have a tool in our office called the IP Identifier tool, and this helps you understand what intellectual property you may have. So if you're looking to find out if you have something that's patentable, if you have a trademark, it may be a copyright. This brief tool will actually go on and provide you with information once you fill out the brief information in the survey, and provide you with information about what intellectual property you have available to you. And it will give you recommendations on how to move forward and where to get started. If you're not in the Washington, D.C. area where our main headquarters office is, we do have regional offices around the country to support you and assist you. We have our Northeast regional office, we have our Southwest, Western, Rocky Mountain, and Midwest regional offices. And we are going to be having in the future our Atlanta office. So those are areas where you can go and find out more information, get support, and connect with somebody who can walk you through that journey of your intellectual property. In addition to those centers, we have our patent and trademark resource centers. These are usually located at libraries on university campuses or libraries in large cities. These are in your local area, but you can go online to identify where in your area there may be a resource center available to you, and they can assist you with the basic understanding of what intellectual property is and how to do searches in those libraries. So take advantage of finding out resources near you that you can utilize. In addition to that, you can always go on to our website where you can find more information for inventors and entrepreneurs. This page will allow you to get started, help you with information that may be more advanced if you've already submitted your application, and connect you with resources within the federal government to support you along your way. We also have our Access Startup Resources page, where you can also learn how to protect your IP and explore free government resources that you may not be aware of that are part of the innovation ecosystem. So it's an opportunity for you to go beyond just your intellectual property, but for resources to support you along the way. Last but not least here is our legal assistance program. This is a program that if you qualify, you can get free legal support. And that legal support is done through our pro bono program and through law school clinic certification programs. To find out if you qualify, you can use the links attached here, or log on to our website and search for Pro Bono to get more information about the resources available to you to support you if you're looking for free legal support and find out if you qualify. We also have more programs like these today, and if you're interested in those programs, you can log on to our website, www.uspto.gov/events, to find more programs online or in your local area to support you in your innovation journey. And if you're interested in getting updates, you can always connect with us by registering on our listserv, where you'll get updates and alerts related to programs, services, and announcements coming from the agency that you may be interested in or that may support you in your journey as well. And finally, I'd like to say thank you for joining us today. We appreciate you being here with us, and we look forward to working with you in the future. Thank you.